Bronchopulmonary dysplasia, or BPD. No one likes BPD. NICU providers don't like it, NICU nurses, respiratory therapists, pulmonologists, cardiologists, developmental pediatricians, ICU doctors. The list goes on and on. It's a chronic lung disease with lifelong consequences. BPD puts a huge burden on our patients, families, and the overall healthcare system. Unfortunately, the rates of BPD are going up, and it's not just because of increased survival of preterm infants. BPD rates are increased even in more mature, extremely preterm infants. How can we prevent BPD? Researchers in the past have tried numerous strategies to prevent BPD, but with only limited success. Two of those strategies are late surfactant replacement and postnatal corticosteroids. Surfactant is a life-saving therapy for preterm infants with RDS. It's usually given as an early treatment within the first 72 hours of life. However, many preterm infants develop surfactant dysfunction due to surfactant inactivation after 7 days of life. This is called post-surfactant slump. There have been several large randomized clinical trials on late surfactant replacement as a therapeutic strategy to prevention of BPD. Unfortunately, late surfactant replacement did not prevent BPD. However, late surfactant resulted in significantly improved long-term lung outcomes. That is, less hospitalizations, less wheezing, less respiratory symptoms. These trials also showed that late surfactant replacement is a safe therapeutic option. What about postnatal corticosteroids? Postnatal corticosteroids are being used very frequently in the neonatal intensive care unit to treat the ongoing lung inflammation. It's an effective therapy for prevention of BPD. However, due to its systemic administration, postnatal corticosteroids results in significant short-term as well as long-term side effects. Researchers have tried inhaled corticosteroids as a more targeted lung treatment, but the drug delivery is less than ideal. What if we combine these two treatments? What if we combine late surfactant and postnatal corticosteroids? Late surfactant for surfactant dysfunction and postnatal corticosteroids for lung inflammation. What if we mix late surfactant with budesonide and administer that combined treatment directly into the lungs of patients, a more targeted treatment for the sickest of the babies? This is where the Little Lung study comes in. Little Lung study is a phase 2 single-center pilot clinical trial of late surfactant mixed with budesonide for extremely preterm infants who require mechanical ventilation between 7 to 14 days of life. We plan to administer 3 daily doses of calfactant mixed with budesonide for 20 eligible infants. The study will be conducted at Unity Point Health Meritor Neonatal Intensive Care Unit, a level 3 NICU in Madison, Wisconsin. And the study will go on for a 2-year time period. The aims of the study are to assess the feasibility of administering this combined treatment, to evaluate the clinical response, and importantly, to investigate the safety profile of late surfactant mixed with budesonide. We also plan to investigate the efficacy by comparing to a historic cohort of patients. We have secured funding through Beretta Foundation. Surfactant for the study will be provided by Oni Biotech. Currently, we are in the process of obtaining IRB and FDA approvals, and we anticipate that we will be starting enrollment in few short months in January of 2025. We hope that this study will generate important clinical data that can be utilized in designing a large randomized controlled trial of late surfactant mixed with budesonide. The overarching goal is to develop an effective therapy for prevention of BPD, the terrible disease that no one likes. Thank you very much.